And now let me turn this to you actually, because the virtual essential care has opened our eyes into some of the specific needs that our consumers have. The leading cause of it being obesity. The weight control or healthy weight has become a significant challenge for majority of our population in 21st century. Again, as a newly minted physician who's been involved in designing and delivering the BowTie Health Guardianships, what are your hopes and what are your projects that you're working on to solve some of the issues that kind of goes above and beyond the essential care?
Absolutely, Dr. Daneshkari, and I really appreciate the opportunity to speak on these subjects. So before moving on into to give a spoiler, our virtual chronic condition clinics, I want to reiterate what you said before. Really, a person who experiences healthcare, a healthcare consumer, does not really care about what ologist that they ultimately meet and handles their complaint. They care about their medical complaints being addressed, and they care about receiving a good health outcome. It's kind of similar to, say, Steve Jobs' idea of the iPhone. Within an iPhone, there's so much complex technology. There's a scheduling system for the operating system, very, very technical information, and so many possibilities. But ultimately, the user of the iPhone doesn't care about the operating system. They don't care about the different ways you can schedule or perform processes. What they care about is meeting their banking needs, being able to connect with their friends and family, these distinct needs that they can understand within their own words because it's part of their experience. And it's the same way with healthcare. We don't care about talking to a cardiologist or a gastroenterologist or a pulmonologist or whatever other ologist. We care that our shortness of breath is taken care of, that our worries about having a heart attack or the development of cancer are addressed, a good health outcome. And so what that brought my team into considering is the development of these easy access virtual clinics that allow individuals, consumers of healthcare, to meet whatever specialist is required in order to address their specific complaints. The most, as we know, the most common causes of morbidity within the nation are things like obesity. We're living within an obesity epidemic, but other things like musculoskeletal pain, osteoarthritis, these conditions that you may present to your primary care physician in the sick care system and ultimately be referred to a specialist anyways. So what we've built are a series of what we call virtual XX clinics. XX meaning that there are an array, a collection of most common health complaints that a member might want addressed. And the purpose of these virtual XX clinics is in a similar manner to pressing an icon on your iPhone home screen, activating the correct specialist in order to get you the care that you need. So, for example, our first virtual XX clinic is our virtual obesity clinic. Again, very, very common issue and a very, very complex issue. Obesity is an issue that includes factors like lifestyle. It includes factors like behavioral health or your mental state in the present moment and over time. And it also includes medical factors. What medicines are you taking? Could they be causing unhealthy weight? Could they be causing, in the setting of an unhealthy weight, other what we call comorbidities, things like high blood pressure or high cholesterol that, if paired with obesity, could drastically increase the risk of something like a heart attack. And so we understand that with this virtual healthy weight clinic, in order to assist our consumers in establishing and maintaining a healthy weight, a healthy lifestyle, and reducing the risks of morbidity and mortality that may come about from having an unhealthy weight, we allow them unlimited 24/7 access to health coaching services led by what we call a nurse guardian, who is financially incentivized and equipped with specialized tools and knowledge that allow this person to greatly benefit our members by guiding them towards a healthier lifestyle, establishing health goals, and establishing the right behavioral health and lifestyle regimen in order to assist physicians and mental health specialists in doing their job. At the same time, we equip them with access to a physician, an internal medicine obesity specialist that knows the ins and outs of obesity, the different causes, the different risks, and the ultimate outcomes. So by looking at a member's complete medical history, they are able to pinpoint the most potent factors in a person's life that cause them to have an unhealthy weight, that cause them to be at risk for comorbidities that, when they have an unhealthy weight, could give rise to a health event. And at the same time, we allow them to have access to a behavioral health specialist that maybe in some cases a person may use food as a way to feel secure, or food as a coping mechanism for events that they are still processing. And this really enables our consumers to receive this interdisciplinary 360 care that addresses an unhealthy weight and allows them to receive the best health outcomes.
As you know, as you mentioned, the obesity and the maintaining a healthy weight is a challenge for a lot of people in this country. In some of the states, more than half of the population is obese. And as you know, there's been a wave of significant increase in use of medications, such as Ozempic or GLP-2 agonists, that has created a significant increase in the cost of this problem. So, as a part of our disruption of the healthcare, we know that the medications do have side effects. These are not the long-term solutions for a problem of obesity or weight control, and therefore, the virtual XX clinic that you're leading has really brought interdisciplinary that requires or is needed for a person to go from an unhealthy weight to a healthy weight, but in terms of their lifestyle that includes their behavior toward their food, their nutritional understanding, and their physical needs, whether they need medication or not. And again, short of a virtual offering, I can see how burdensome this could become for the consumer to receive these services, but more importantly, how it would add to the lack of compliance. As you know, in many of these chronic multiple factorial conditions, one of the complaints of the sick care system, again, is the lack of compliance. Whereas you and I know in any other part of life, when people are positioned in the position of control and the power, for their education, for their money saving, for their safety in driving and so forth, they take control and they're very compliant, right? So this goes back to the example of the iPhone you made. Historically, the issue of the board certification and the specialization was really to control the quality. So as you know, I'm a double board certified. But the board certification in the eyes of the consumer, to me, should not play a role. It's really a guarantee or assurance of the quality that I know what to do in the areas where I am basically board certified. But when it comes to satisfying the need of the consumer, right, we have to disrupt the system to deliver it at the need. Again, I can go back to a mechanical examples or the food. Really, as a consumer, you don't care what kind of process control went to bring in the blueberries that are healthy and organic to your store. All you care is that the taste of the blueberry, they're free from chemicals, and the cost of it. What a specialty went to bring those services to you is kind of irrelevant. It's the provider's burden and the provider's cost of running a business. So this set up the change in the mentality of bring the interdisciplinary group of specialists and equip them with the tools that they need to deliver the care, such as the home monitoring devices, and so forth. To me, this would disrupt and move our attention from the right side of the bow tie to the left side.
Oh, absolutely. And really, now that you talk about it, this really echoes your past point about turning from a provider-centric model into a consumer-centric model. So we have really made significant efforts both in designing this product for the virtual healthy weight clinic and also our plans moving forward to maximize convenience to our consumers, meeting them where and when it is most convenient for them, whether it be at home or at work. In fact, for a lot of our members, we've actually installed a virtual kiosk on site so that if they are requesting a virtual appointment with us, they are able to do so on, say, their lunch break. Take a quick 15-minute video conversation to speak to, say, a nurse health coach. And I think what this echoes is something very important that you said, which is the issue of an unhealthy weight is not just medication. Although we have some fantastic medications these days like GLP-1 agonist, your Ozempic, those elements of management of an unhealthy weight, they are included within a virtual healthy weight clinic. Our physician is freely able to prescribe phentermine and Ozempic and other medications when it is indicated. But in so many cases, we have the issue of an unhealthy weight not being caused by a lack of medication, but rather caused by lifestyle factors that require the consistent engagement of the member in their own health. And this is a very complex and long-term problem. It involves interaction with, say, the member's spouse. And that's why we actually enable, even if our spouses don't necessarily meets the criteria for the virtual healthy weight clinic, we enable spouses to enroll so that they may make this a joint effort that they're doing together. I always tell everybody that our virtual healthy weight clinic has two strengths. I think the first strength is, as you said, it's in the specialists, their specialized knowledge in order to map out the entire domain of causes of an unhealthy weight and conform to the needs of the consumer in order to get them the best health outcome. But I think the second strength is really our data-driven approach, the utilization of these unique remote patient monitoring tools that are at the bleeding edge of innovation in healthcare and simply allow possibilities in the collection of data at a frequency and at an accuracy and precision that simply is not possible within the traditional brick and mortar office visit way of obtaining healthcare. Actually, we integrate all this data into one central data storage warehouse where we get the entire universe of information, whether it be the health outcome data, data related to member engagement, how engaged are they in managing their own healthcare, how are they perceiving their healthcare that they're receiving, as well as their current health status, all the way over to, say, medical claims, cost information. What care are they receiving and from whom and when are they receiving it and how much is it costing? What are they at risk for in terms of out-of-pocket expense and also in terms of health risk? What for this individual, for any individual in our cohort, are they at a unique and personalized increased risk for, whether it be something like a high blood pressure based off of everybody in their family has high blood pressure, or diabetes if everybody in their family has diabetes, or if they're in a state where they may end up developing a chronic condition. And so using this universal perspective, looking at all this data that's generated from our virtual first approach to delivering healthcare, we're able to perform analyses that are simply not possible within the sick care system. One other aspect of this data analysis is that data isn't always the end-all be-all. In fact, in some cases, there may be so much data that we simply could not analyze it. But leveraging new technologies that have actually manifested within the past year, we are able to take entire corpuses of unstructured information, all the medical notes that a patient may have or receive within their medical record over time all the different claims information, all the different discussions that they may have on a phone call, and actually interpret it and synthesize it so that people on the provider end can truly understand and utilize that data. In effect, we're turning all these individual points of data, blood pressure measurements, medical visit notes, prescriptions, family histories, and turning it into actionable data so that our providers can lead our members to the best health outcome.